Hey you guys, my name is Dr. Nicole Peoples, and I am an internal medicine physician. Also works as a hospitalist. I also do integrative and functional medicine. And I was just like the rest of you guys, I am sort of processing all this information about COVID. I've been watching all kinds of videos. I've been on the CDC website. I get briefings from the hospital that I work at. I talk to my colleagues who are in ER and infectious disease, internal medicine, and it's a lot of information. And I'm finding that people sort of have a little bit of knowledge about it. They have somewhat of an understanding about it, but I was a little frustrated that I feel like people just aren't getting the severity and the importance of this pandemic. And so I wanted to take some time to kind of compile some of the information that I've been able to digest and use some of the graphics that I thought were really helpful. I'm a visual learner myself, so I put in a lot of graphics that I've got from other people who've compiled easy ways for us to understand this, and then also some videos as well, just to sort of reiterate that I'm not just sort of telling you what I believe, but sort of what the common consensus is out in the public. So I'm going to go over a number of topics. I'm going to do this in multiple videos to try to keep them really short. So let's jump right in. So I want to first talk about what the basics of COVID-19 are. So I've heard a lot of people say, oh, this is, this coronavirus, it's been out there before. This isn't like anything new. Why are they making such a big deal out of it? It's no different than the flu. It's just like the flu. So I really want to address some of those concerns. So if you understand that the coronavirus has been out here before, that is absolutely true. However, there's a family of coronaviruses, and this is, I think, the seventh coronavirus that has been out there. So if you remember SARS, severe acute respiratory syndrome, or MERS, Middle Eastern respiratory syndrome, these are all coronaviruses. And COVID-19 is the seventh. And so it's different from the others because this particular virus has not seen human populations before. This is not something that we have ever seen in the human population before. And so it's a novel or new virus to us. And so let's talk a little bit about how that might compare to some other viruses, specifically the flu, because I think people understand the flu a little better. So number one, the first thing we should know is that the flu is a very serious disease and people die from it every year. And we are actively working to keep people healthy and prevent flu. However, when you compare it to COVID-19, we'll find that the first thing we want to look at is how contagious is it? And we look at COVID-19 and it's almost twice as contagious as the flu. So if you look here, you'll see that 1.3 people can actually contract or get the flu from an average person who's already infected. So if I'm infected, I'm likely to infect 1.3 additional people. If I get COVID, I'm more likely to infect 2 to 2.5 people. So, the ability for me to pass the disease on to other people is greater. But not only that, one of the reasons why that might be the case is because of the incubation time. And so I think this graphic really shows it well. So incubation time basically is talking about how likely is it for me to pass this how likely is it for me to have symptoms, or how long it's going to take for me to have symptoms if I get infected with the virus. So if I'm infected with the flu today, or if I'm infected on a Monday, then I should be showing symptoms by, let's say, Thursday or Friday. If that's the case, then I will take it upon myself to either self-quarantine because I don't feel well, I can't go to work. I'm going to, remove myself from populations, my family. I'm going to start taking care of myself. But what if you don't know that you're sick? What if it takes you 2 weeks before you know that you're sick? You can be walking out there and passing this disease along to people, and you not even know it. And so there are some people who will never have symptoms from COVID-19. And so they're just out here passing it along without knowing it. For the average person, people who will develop symptoms develop it within the first 5 days. And so that's still a long time for you to pass it on unknowingly. Obviously more than the flu. All right, so here's the other issue, and I'm going to talk about this in another video, which is hospitalization rate. So this basically just says if I get infected, of all the people who get infected, what percentage of those people will need to go to a hospital? And so here it shows 2% of the of the people infected with flu will end up in a hospital, meaning that their disease was severe enough to require hospital care. Where you can see this is a huge number. 19% of people who actually get COVID will end up in the hospital. And let me just stop here to say, because this is such a new virus and everything that's going on with this pandemic is very new, this information may change. By the time you watch this, if you're watching this 2 weeks after I filmed it, a month after I filmed it, 6 months, I'm sure a lot of this information is going to have changed. And so this is really just what we know right now. But if we're looking at other populations that have been dealing with COVID over the past couple of months, up to 19% of those people infected were requiring hospitalizations. Now, this can absolutely be skewed because we don't know totally how many people are infected because not everyone is getting tested, right? So this number is based off of the knowledge that we have right now. And then here is why you should really care at the end of the day. And that's the fatality rate. So how many people are going to die if you get COVID? So this is, I thought, was the thing that kind of got me, really understanding what was going on here. And I had to actually go back and look at the numbers, and I'm actually going to pull out my little pad where I tried to simulate, because what I found is that when I was looking for numbers, like when I was looking for people to kind of explain numbers, even on the CDC website, if you're watching any of the news, people are hedging around numbers. And so I don't want to make it seem like I have the answer to the numbers, but let me just tell you, based off of this information, sort of how I break down the numbers and why I think this is really a big deal. So out of the entire American population, US population, 36 million people are suspected to be infected with the flu. All right, so of those 36 million, 0.1% of those people are expected to die from the flu. So that comes out to be about 36,000 people. So that's where we get this number, somewhere between 30,000 to 60,000 people die of the flu every year, just depending on how severe it is. So 36,000 people, 0.1% of people who get infected with the flu. Now let's compare this to what we know currently about COVID. And again, these numbers are based off of current knowledge here on March 19th. So we know that there are 330 million people about in the United States, and people are suspecting that somewhere between 40 and 60% of the population might actually be infected with COVID by the time this is all done and said and done with. So let's just look at the higher number. If 60% of the population is infected with COVID, then that's 198 million people who are actually infected. Now, if 1% of 198 million people actually die, that's 1.9 million people. That is a huge difference between the flu. 36 million, even at its highest, 36,000, or even at its highest with the flu, 60,000 people who might die versus almost 2 million people who actually die from this. This is why we should actually be really caring, because it's going to be hard for you not to know, have relationships, or it may even be you, one of those 2 million people. Now that's on the lower number. If the higher number is true, the 3.4% of people, that is 6.7 million people. Y'all, that is a lot of people who could potentially die from this disease. And that is why this is being noted as a pandemic across the World Health Organization and across the world, because the numbers of people who could potentially die from this are astronomical. And that's just in the United States. And I think in the during the Black Plague, I think 50 million people died during that time. So it's not like this hasn't happened before, and it absolutely can happen again, but we have to do our part. All right, so I'm going to make a couple of more videos. And so I'm going to talk about why we should take this seriously if you don't understand that already so far. Talk about how it spreads, so things that you need to know in regard to that. We'll talk about what the real concern is about how long we need to quarantine and the impact on the healthcare system, and why those two things are even talked about in the same sentence. And then what we should be doing I'll talk a little bit more about that. So those will be my future videos. So I hope this is really helpful. And if you have any questions, leave them below. I'm not claiming to be an expert, but I know as a medical provider, it is my job and the rest of the medical team out here to really give you guys the most up-to-date and appropriate information that we can. So I'm more than happy to help you understand this better. And I will also link a bunch of other references for you to look at to get more information. So until the next video, I wish you optimal health.